evening. This is Doctor Kuldeep Kumar. I am consultant pulmonologist and intensive care expert at CK Birla Hospital. What all symptoms are associated with obstructive sleep apnea along with snoring and unrefreshing sleep are: patient will be continuously complaining of unrefreshing sleep, morning headaches, morning irritability, lethargy, not getting enough meals because they are not hungry, not getting enough amount of water because they are not thirsty, so feeling epigastric fullness, not able to walk because continuously they are tired. And these all kind of symptoms, if keep on accumulating, they lead to further physical and psychological difference in their office and normal home activities as well. So OSA, if untreated, lead to various complications, and as we have seen recently, Papillary have also died of obstructive sleep apnea, because if obstructive sleep apnea is not treated well on time, it can lead to death and loss of life in due course of time also. So there are various treatment modalities available for obstructive sleep apnea. Patients are coming to us in our OPDs. Whenever we are screening patients for obstructive sleep apnea, they are not coming clearly with the symptoms of obstructive sleep apnea, that we are having this symptoms and we are getting screening, we want to get screened for obstructive sleep apnea. Maximum of the times patients are coming with complaints of other respiratory symptoms like of breathlessness, uneasiness, abdominal symptoms. There are treatment modalities for obstructive sleep apnea starting from non-pharmacological and pharmacological treatments. Non-pharmacological treatment is the main primary treatment of obstructive sleep apnea. If a patient has been diagnosed clinically in our OPD that he might be having obstructive sleep apnea, we are telling them and convincing them to underwent a sleep study, that is a polysomnography study that is being done at home or in hospital also. So polysomnography study is both diagnostic and therapeutic, titration as well. Diagnostic and titration means polysomnography study is being done on a 6-hour split night study that involves 3 hours of diagnostic study, during which a sleep therapist will come to your home and he will apply all the pertaining wires and electrodes all over the body wherever the recording is to be done on a computer system to just see the electrical signal while you are being sleeping. So those electrical signals are being cached upon the computer and it will show some reports in the forms of epochs. So study will be done in a split night study of 6 hours. First 3 hours of study would be of diagnosis, that you are having sleep apnea of which variety, whether it is mild, whether it is moderate, whether it is severe. Mild variety, severe variety will be categorized on the basis of AHI. AHI is apnea hypopnea index, which is being calculated in polysomnography studies. If your AHI index is less than 5, it is normal, you are not having any OSA. If your sleep AHI index is 5 to 15, it is mild variety. If your AHI index is 15 to 30, it is moderate variety. And if it is more than 30, it is of severe variety of obstructive sleep apnea. Severe variety of obstructive sleep apnea is being titrated with various treatment modality. First and foremost treatment modality that is being offered to the patient is application of CPAP machine. CPAP machine is a positive pressure machine that is being applied to the patient nose or the mouth to create a positive pressure airway to the patient's breathing circuit. When he is sleeping, we have to apply a mask over the face so that when he is breathing, the choking spells that is happening because respiratory muscles are being narrowed because of the hypotonia or the respiratory muscle relaxation, this positive pressure machine will apply pressure, will give pressure to the airways and mouth, so it will create a positive splint into the airways and it will keep your airways patent throughout the period of sleep when you are sleeping. So it has to be applied while you are sleeping, and some patients might be complaining while initiation of therapy that they are feeling dryness of mouth. So we have joined the CPAP machine with a humidifier. So humidifier will be taking a role. So the air which will go into the lungs or to the airways, it will be the humidified air. So that problem will be rectified subsequently. So what all other therapies available for obstructive sleep apneas? If a person is not tolerating this CPAP machine, are mandibular advancement devices which are being offered to the patients who are not having very much severe grade of obstructive sleep apnea. Pharmacological treatment pertaining to obstructive sleep apnea are being offered to the patients who are having mild variety of obstructive sleep apnea, and specifically it is not beneficial so far which we have seen, and in study also it has proven that pharmacological treatment is not beneficial in obstructive sleep apnea. Awareness about obstructive sleep apnea is very much important, because if we are well aware of the things which are happening to us and our body, we will be very much vigilant that when we have to consult and when we have to well aware of our respiratory problems pertaining to obstructive sleep apnea. So if you have any queries related to this entity which is obstructive sleep apnea, we are very much obliged and welcome you to visit our website for more details, what all things are new and what all things and modalities are available. Because if we are controlling this entity, so we can save maximum lives. Thank you very much for patience hearing. Thank you.